And now I will leave the mic to Dr. Ahmed Hamdi, who will speak to us about an overview about Royal College exams, different exams, and he will present these slides. You are welcome now, Dr. Ahmed, to present now.
Thank you, Dr. Walid. Can you hear me?
Yeah, I can hear you good. I hope all candidates are hearing you also.
Good evening, doctor. This is Ahmed Hamdi, a member of Royal College of Surgeons of Edinburgh. I'm honored to be with you tonight to have some details about the different types of Royal College fellowship tests in ophthalmology and how to study and how to choose which one is suitable for us. We all hear big names like International Council of Ophthalmology. We hear also about the Royal College of Surgeons of Glasgow. Also, there is Royal College of Surgeons of Edinburgh. And finally, there is Royal College of Ophthalmologists of London. What is the difference? Hello?
We can hear you, Dr.
Can you hear me? Hello?
Yes, we can
Is
hear
everything
you.
Okay? Okay. So, we are through these types of fellowship exams. We will know what is the difference between them. First of all, we need to know, as Dr. Walid said, what is the value of different types of Royal College fellowship tests. As he said earlier, the best and the most important thing in studying a fellowship is you know how to practice. You know that there is a novel by Paulo Coelho. It's called Alchemist. Many of us read it. It's about a simple guy who gone through a journey to reach a treasure. And finally, at the end of the novel, he found out that the treasure was in the journey. This is what about the FRCS. The treasure is your study. Treasure is to know how to deal with a patient, like a patient, not like a textbook. You know that the patient is as a whole, not as a group of symptoms and signs and investigations and treatments. This is the best thing about FRCS. Second of all, the reputable qualification, it ensures that you have the acceptable level of knowledge to practice as a safe doctor. Also, it gives you a license to practice in the United Kingdom and Ireland if you have the IELTS exam. Moreover, it can make you a specialist in Egypt and take the syndicate registration. Also, you can travel to the Gulf and work as a specialist with the FRCS. And in some areas in Gulf, you can even be promoted to a consultant. Also, the ICO exam can give you a privilege to admit to the ICO fellowship. The ICO fellowship. The ICO fellowships are training programs organized for the developing countries that can take a 1 month or 3 month training in a developed country. So if you have ICO first part or second part or the third part, it can make you have a better opportunity to apply for this. Can you hear me? Is everything okay? Is the voice have a poor quality?
For me, the voice is okay.
Some members say that the voice has the quality. Okay. We shall proceed now. So, we may get confused about different types of fellowships and how to choose between them. So let's review some details regarding the different types of fellowships and how to and how to admit into them. I apologize very badly for the technical error. Some slides will become reversed, but you can concentrate with my speaking so I can illustrate these differences to you. We have, as we said earlier, 4 types of fellowship. We have ICO, we have Glasgow, Edinburgh, and London. All of them consist of 3 parts. The first part in each of them is a basic science test with optics. A basic science with optics for all of the 4 exams. The second part is a clinical science in ICO and Glasgow and Edinburgh. While in London, the second part, I apologize that the slides are reversed. It is a technical error. We could do nothing about it. The second part of different types of fellowship is a clinical science test. Except for London. In London, it is a refraction test. Only refraction. You won't be examined in anything except refraction. The third part of each test is a clinical exam. The third part of the ICO exam will entitle you the title FICO, or Fellowship, or a Fellow of International Council of Ophthalmology. While the second part of Part3of7 Glasgow, the Part3of7 Glasgow will entitle you Fellowship, Fellow of Royal College of Surgeons of Glasgow. The striking feature about Edinburgh that the second part will give you membership. So if you have the second part of Edinburgh, you have MRCS, or Member of Royal College of Surgeons of Edinburgh, while the third part will give you FRCS, or Fellow of Royal College of Surgeons of Edinburgh. The third part of London will give you FRCOF, which is the Fellow of Royal College of Ophthalmologists of London. About exemption, you can exempt from the first part of Glasgow if you have the first part of Edinburgh. Also, you can be exempt from the second part of Glasgow, not the whole part, only the problem is the MCQ part, if you have the second part of the ICO. If you have the first part of FRC of London, you will be exempted from the first part of Edinburgh. Also, if you have the second part of London, which is the refraction certificate, you will be exempted from the refraction station of the second part of Edinburgh. About eligibility. When you are eligible to sit for the exam, in the first part, you have to have your primary medical qualification, which is NDDPH. In the first part of Glasgow and Edinburgh, you should complete 1 year of experience after internship. On the contrary, the ICO and London doesn't require such experience. You can sit first part of ICO and London while you are in internship. But note something, that the level of difficulty differs greatly between ICO and London. The ICO is considered an easy test. You can pass it easily without experience, while in London it's unlikely that you pass without experience. The second part of the ICO requires to succeed in the first part only. While the second part of Glasgow needs a huge experience, you have to complete 5 years of experience after internship, which is a lot of time, and we will discuss how to overlap this or get over this problem. The second part of Edinburgh will require only 20 months after internship, while the refraction certificate of London doesn't require an experience at all. The third part of ICO doesn't require any experience, only to succeed in part 2. The third part of Glasgow doesn't require any more experience, just the 5 years, the previous 5 years are enough. While the third part of Edinburgh requires you to finish 4 years of experience after internship. And finally, the second part of London also doesn't require any experience at all. Let's review now the format of the exam. The first part of all exams is an MCQ test in basic sciences and optics. The first part of ICO consists of basic science exam. Please don't change the slide. We are in the previous slide. The first part of ICO is a basic science test which is consisting of 80 MCQs, which is a single best answer of 4 options in 2 hours, and a theoretical optics and refraction test, which is 40 MCQs, which is a single best answer of 4 options in 1 hour. The first part in Glasgow and Edinburgh are more like the same. It is 160 MCQs, single best answer of 4 options, but the main difference is that the first part of Glasgow is only 2 hours, while the first part of Edinburgh is 3 hours. However, I think, in my opinion, the 2 hours in Glasgow is exerting a tremendous pressure over the candidates, as 3 hours over 160 questions is barely enough to finish. The first part of London is a total story. It doesn't only consist of an MCQ paper, also another paper called Constitutive Response Question Paper. The MCQ paper consists of 120 MCQs, which is a single best answer of 4 options, consists for 3 hours. While the other paper, it is like an essay type of question, where you have a question and write an answer, a detailed answer, and it is corrected by an examiner. You may have some quotes in this part of questions. That's why it needs experience, because you may have some investigations, some pathology slides, some clinical reports, some questions that need that you have to practice some ophthalmology. Now, let's review the second part. The second part of ICO is 200 MCQs in clinical science. This is one of the most long exams which you may go through. It is 4 hours. 4 hours you solve 200 MCQs. While the FRCS Glasgow consists of 2 parts. The MCQ part, which consists of 80 MCQs, single best answer of 4 options, and the time is very critical here. It's only 2 hours. Then after you finish the MCQ part, you will have a rest for 15 minutes. Then you will solve problem-solving part. In the problem-solving part, it will consist of 4 questions. The problem in this problem-solving part is that there is an emergency medicine question. This emergency medicine question is the success in this question is mandatory to pass the whole exam. The duration of exam is about 2 hours and 15 minutes. In the Part3 Edinburgh, the Part B, the Part B is different from all other exams because this part can give you a license to practice. This part will give you MRCS or Membership of Royal College of Surgeons. That's why it must consist of oral and clinical exams. That's how the examiner will make sure that you know how to deal with the patient and how to diagnose and how to prescribe treatment and how to order investigations. That's why it is not only a paper exam. In the Part B of Edinburgh, there is 3 types of tests in 3 days. In the first day, you will have a clinical extraction examination for 30 minutes. While in the second day, you will go through 3 OSCE stations. OSCE is abbreviation of Objective Structured Clinical Examination, which is a clinical examination as we know it. You will go to the anterior segment station for 20 minutes, posterior segment station for 20 minutes, and the neuro-ophthalmology station for 20 minutes. Then, in the third day, you will go through oral exam. The oral exam consists of 4 tests. The first one is in ophthalmic medicine, the second one in pathology, the third one in general medicine related to ophthalmology, and the fourth one in the medical ethics. Note that in Edinburgh, in the Part B and the Part C, if you fail one station, you repeat it only. You don't have to repeat the whole exam. The second part of FRC of London, as we said earlier, it is a refraction exam. It is a refraction of consists of 12 OSCE. You may be asked to refract an adult, then refract a child with cycloplegic and non-cycloplegic refraction, to do examination of a lens under the 50 meter, to examine for heterophoria and heterotopia, to do Maddox-Rod and Maddox-Wing. So this is a full refraction exam in 12 stations. Now we are going through Part 3 or Part C, the last part of the exam. In the ICO, the third part is a 3 hours exam consists of 10 EMQs. EMQs stands for Extended Matched Questions, which is more or less like the MCQs with clinical scenarios. In this exam, you will be tested for clinical science, and there is a certain system in this exam for marking to ensure that if you are confident of your answer or not. So if you are not confident of your answer and you said that you are sure of it, you will lose marks. It is more or less like the American system. So if you are not sure of your answer, you just say you don't know and you will have 0. Otherwise, you can lose marks. The third part of Glasgow consists of 2 types of exams, oral exam and the clinical exam. The oral exam, you will have 3 stations. You will be examined or asked in ophthalmic medicine and ophthalmic surgery and the pathology. And the third station, which is the problem also about FRCS Glasgow, is you will be tested for general medicine and neurology. In the second part of this test, you will have to go through clinical examination. In clinical examination, you will be tested in the anterior segment, posterior segment, neuro-ophthalmology, and oculoplastics. Note that the scoring system in third part of Glasgow, you will be examined at 2 examiners at each station. Each examiner gives you a score from clear fail, then fail, then good, very good, and pass. If you have failed at more than 3 examiners, you will repeat the whole test. Also, if you have a clear fail at 1 examiner, you will repeat the whole test. This is a huge disadvantage in Glasgow over Edinburgh. The third part of Edinburgh consists of 3 parts. The first part is MAOE paper, which is a clinical scenario like that of the ICO for 3 hours. The second part is an oral examination. Will cover all aspects of ophthalmology, including oculoplastics, cornea, cataract, glaucoma, retina, uvea, neuro-ophthalmology, strabismus, and the main difference here is that you will have to admit a logbook, a research paper, and an audit report, as we are going to explain in the last part of this session. The third part is a clinical examination. It is more or less like that of the second of Edinburgh, but with more details and more depth, and the level of cases is more difficult. Also note that in the third part, if you failed in 1 station, you repeat it only. You don't have to repeat the whole exam, which is an advantage in Edinburgh over Glasgow. In the final part of London, there is 2 sections. The first section is an MCQ paper, and if you succeed in it, you will travel to London to sit for the oral examination and the clinical examination. For exam dates, the ICO first part and second part are set in April every year, while the third part is set once in October. In the FRTS Glasgow, the first part and the second part are set twice, in March and October, while the third part is now set 5 times in the year, in Glasgow, Jordan, India, and Oman. The FRTS Edinburgh first part is set twice in April and October, while Part B is set 3 times in March, June, and November. In Cairo, Edinburgh, and India. While the Part C is set 2 times in March and June, it is now in Edinburgh and India. It is written in the website that the third part will be set in Egypt soon, but till now it is not held in Egypt. The first part of London is set 3 times per year in February, May, and October. The refraction certificate is set twice here in June and November, and finally the third part, or the oral and clinical exam, is set twice here in April and November. Now please everyone focus with me. This is the most important slide, which is the main difference between different fellowship tests and which one to choose, and what makes everyone distinguishable from the other. Let's first talk about advantages and disadvantages of ICO. The advantages of ICO that it gives you privilege when you are applying for ICO fellowship. As we told earlier that it is not a prerequisite. The ICO parts are not prerequisite if you are applying for ICO fellowship, but it makes you or your application more distinguished and more favorable to be accepted. The second huge advantage of this second ICO is that it exempts you from the MCQ part of the second part of Glasgow. If you pass the first part of Glasgow or the first part of ICO, you will have to wait for 4 years. 4 years to be eligible to sit for the second part of Glasgow. However, if you can buy yourself some time in these 4 years by sitting for the second part of ICO, so that you will be exempted from the second part or the MCQ part from the second Glasgow. Also, if you are in Egypt, having any part or any first part of any Royal College fellowship test, it can exempt you from the first part of Egyptian fellowship exam. Okay, what about disadvantages? The disadvantages of ICO that it doesn't give you a license to practice, because as you may notice that it is not an oral or a clinical exam, it is just a paper-based exam. That's why it can't give you any license to practice anywhere, even in the United Kingdom. The advantages of the second part of the Glasgow, it is the most popular. The FRCS Glasgow is the most popular. That's why you may find the exam is easy, because many candidates have gone through this exam and they can tell you about their experience about it. But what about disadvantages? The disadvantages mainly is the emergency medicine. The emergency medicine in the second part and the third part, it may become a dilemma for some of us, because in the second part, success in the emergency is mandatory. Also, one of the disadvantages of Glasgow is that if you failed in one station, you will fail in one station, you will have to repeat the whole exam. The advantages of FRCS Edinburgh is that it is the only exam that will give you a membership after the second part. It will give you a license to practice after the second part by giving you a member of Royal College of Surgeons. The second most important feature that it doesn't require much time to sit for the exam. You can sit for the exam of the second part only 1.5 years after the internship. So if you are a fresh graduate and you want a license as soon as possible to work in your country or to travel abroad, the MRCS Edinburgh will be the most suitable pathway for you. Also, one of the advantages of Edinburgh is that failure in one station, you will have to repeat it only. You don't have to repeat the whole exam. But there are also disadvantages, that it is expensive, and you should consider this because sometimes you may not finish the exam from the first time. So you should consider the financial burden you will endure for this exam, especially that it is moderate in difficulty. It is more difficult than Glasgow, but it is less difficult than London. The advantages of FRC of London is that it will make you compete for consultant jobs in the United Kingdom. If you don't want to work or to pursue a consultant job in the United Kingdom, then you don't have to set up FRC of London at all. Also, you can make your training equivalent with the training of the United Kingdom trainee, the British and the European trainee, through an Article 14 to apply for consultant job. So, passing FRC of London is not enough only to apply for consultant jobs in United Kingdom. Also, one of the advantages is that there is no experience required. The disadvantage, of course, is that it is the most difficult exam. You will be asked for details that you may not encounter in your practice, like health economics, things that you will not be able to understand and to get acquainted with if you are not working in the United Kingdom. Finally, the take-home message is that the Royal College Fellowship tests are reputable qualifications that ensure the best way to practice ophthalmology. The Royal College Fellowship tests open many career opportunities in Egypt and outside. To pass the Royal College Fellowship test, you have to practice. You have to practice on a daily basis. That's how you make your understanding of ophthalmology is perfect. That's how practice makes perfect. And as we're going to discuss later on, you have to study smart, not hard. Not about the amount, it's about the quality, not quantity. And the last part, if you fail to plan, then you plan to fail. And that's what we're going to talk about in this session later on. Thank you very much.
Thanks, Dr. Ahmed, for your wonderful session. And now, if anyone has any questions about this session, he or she is welcome to ask about this. And also, if Dr. Muhammad Saad have any comments about this, he is welcome to say.
This is okay, Dr. Walid. Thank you, Dr. Ahmed, for this nice lecture. But I want to comment about the advanced ICO exam. The new regulations is to multiple choice questions has no negative mark. This is a new regulation just updated in the last year. Because I admitted for this exam, but unfortunately I didn't pass. But the new regulation is to be MCQ and the commentary exam without negative marks. The second point I want to comment about FRCS Glasgow clinical Part 3. There is in the new regulation is there is an overall pass mark for the oral. If you achieve the overall pass mark in the oral exam, you can pass. Even if you fail in more than 3 exams, but you will achieve the overall pass mark in the oral exam, you can pass it. But the clinical exam, clear fail in 1 session from the 4 sessions, give you a clear fail in the whole exam, oral and clinical. Just for reminder.
Thanks, Dr. Muhammad. Any one of our colleagues want to comment by anything or want to ask any question? By the way, I want to highlight something. If you want to take the mic, there is one button here which is raise hands. You can press this button here in this area, and after this button it will appear for me, and I will give you the mic. Dr. Ahmed Mujahid is asking about Irish. What do you mean, Dr. Ahmed?
Well, my information about the Irish exam, that the first part is held in Ireland. You will go to Dublin and sit for it. It's a basic science test. The curriculum of Ireland is very huge. It is more or less like that of the FRC of London, and it needs much thorough study. When you travel to Ireland, you will sit for the first part, and the second part is more or less like the second part of Edinburgh. It is an oral and clinical exam that will entitle you the MRCSI, Membership of Royal College of Surgeons of Ireland, which is also a huge privilege because it gives you a license to practice in Ireland. But I don't have much experience about it.
Okay. Also, I noticed one question from Dr. Rana, and this, by the way, is a nice question and frequently asked question. Dr. Rana is asking if there is any specific time frame after being FRCS member during which UK registration has to be completed. The clear answer
Yes.
for this, Dr. Rana, in the website it is written you must complete the registration process within 3 years after obtaining the degree. But I want to tell you something, may be happy for a lot of my candidates who pass the exam more than 3 years. It is possible also to obtain the registration after 3 years, but provided that you will provide them a statement or a certificate that you are practicing ophthalmology and you didn't stop practice of ophthalmology during this period of interruption. So the usual pathway is to register after 3 hours, within 3 hours, but if you want to register after 3 hours, you must submit them a certificate of practice of ophthalmology. I hope this is clear for you, Dr. Rana, and if Dr. Ahmed wants to comment, he is welcome, of course.
I agree with you, Dr. Walid. You have to complete the registration process within 3 years after obtaining the qualification. It is new information for me actually that could still have the registration after the 3 years. And thank you for this information, Dr. Walid.
Thanks, Dr. Ahmed. Dr. Manal also is asked about in advanced ICO, what's the type of questions and how to read in this exam. Dr. Manal, we will have a slides about study sources, but about the type of questions, can you answer this question, Dr. Ahmed, about type of questions in advanced ICO exam?
May Dr. Muhammad have much experience regarding this exam since he sit for it.
Okay, Dr. Muhammad, please can you answer this question?
Yes, sir. I admitted for this exam in the previous October. The exam is about 10 EMQs questions and about 75 MCQs. But the problem for this exam is it's really difficult. It is deal with advanced level of knowledge. The exam not asking directly about the information, but he asked about the details of the details that related to the information. Also ask a lot about studies, which we are not consider that in our practice. Studies in the cornea and in the corneal abscess, in the corneal in the diabetes is much more familiar with us about the study of diabetes, but the exam is really difficult. The old method for assessment, as Dr. Ahmed say, have a negative mark if you answer the questions wrong answer, you give a negative mark, and the certainty level of knowledge. This was the old method. Now the EMQ, this is a paragraph with missing parts and the correlation A, B, C, and you choose and match between the missing part in the paragraph and the multiple choice, and write the answer in a sheet like any ICO exam, basic or clinical science, the same answer sheet. But it is really difficult exam, and the advantage of it is to have a fellow to ICO and give you opportunity to take in ICO website there is some learning programs you can attend when you have a fellow to ICO, give more opportunity than others. But I don't admit this again, except if I have an exam in the October other exams, I will admit it. I can admit it again. But the exam very difficult, and the assessment form sent to me after exam give me analysis for my answers. There is a certain difficulty, and the assessment form say that we know that this is a really difficult exam. This is my experience about advanced ICOs.
Thanks, Dr. Muhammad. I also I have 3 more comments before moving into another section of this session. The first comment, I want to tell you that, in my opinion, the third part of ICO exam is of a very little value. So just take it if you have free time, just take it if you have extra money, but practically the third part of ICO exam is of a little or no value. This is number one. Number two, I want to highlight that in the new regulations of the second part and the third part of Glasgow, there is only 6 attempts for exam. So after 6 attempts, now what I know, because I contacted the Royal College before about this, they told me that you must have a certificate from a previous fellow saying that your level is improving and you can apply for the 7th time. So the new regulations of the third part and second part of Glasgow is only 6 attempts. But I am sure, inshallah, all of you planning to sit for third part Glasgow, you will do it, inshallah, from the first part. Also, I will speak about the most important point that is a real challenge for all applying to Glasgow exam these days. It is not just important, it is not only difficult to pass exam. The exam, inshallah, will be easy and you can pass it easily. But the difficulty now is to how to admit for exam. The Glasgow exam nowadays has a lot of candidates want to sit for it. So if your applications arrive before the closing time, it will be rejected. Also, if your application arrived after the closing time, it will be rejected. But the problem here is when the opening date of Glasgow exam is announced through website, all of candidates are sending the applications, and they have limited number for candidates wishing to, they have a limited number for candidates to sit for this exam. Mostly 50 candidates. So if your application arrived after the 51, the 50 candidates, they will reject it. They will reject it even it arrived within the closing date or opening date of the exam. So my advice here, you must, and this is a very useful advice. My advice in few steps. The first step, you must ask your career in your country, for example, DHL or FedEx or whatever you will use to send this application, about the time exactly needed to send your application to be reached in the Royal College at the opening date, the first opening date. And when he tell you this time, for example, he will tell you it will need 2 days. So you will send your application before the opening date by 2 days. So it will arrive at the college at the opening date, and you will have a great chance to sit for this exam. I will give you an example. Suppose the opening date for coming exam is, for example, 25/7, and you ask in your country, and you will for example, you will send for DHL, and DHL told you that it needs 2 days for your application to arrive the Royal College. So you will send your application 23 July. So it will arrive 25, which is the first opening date, and then you will have a great chance to admit for this exam and to have a place for this exam. This message is very important because I have a lot of colleagues waiting for more than 1 year just to have a place in the exam.
your advice.
Dr. Mu'taz is asking about what are the privilege of FRCS Glasgow for practice in England. We already speak about this, Dr. Mu'taz. Maybe you missed this. We told you, and Dr. Ahmed told you, that when you have the FRCS certificate, you will go for IELTS test, and when you finish the IELTS test with a score 7.5, then you will be eligible to have GMC registration, and also you will be eligible to have IMC registration, and this will permit you to work in England. And inshallah, in our academy plans, we are planning to organize a session by the title, What is After FRCS? We will speak about this in more detail. So follow us. There is a special session for this, will be announced there. So now, back to the session.